Welcome to Stoughton Media Access Cable. My name is Steve Kelley and I'll be your host for today's show. Today I'd like to welcome, and bear with me with the acronym, the Center for Information and Study of Clinical Research Participation. And I've got two wonderful ladies who are representing the center. To my left, I have Ellyn Getz. Hi, Ellyn Getz.
Hi, Steve.
Welcome.
Thank
and
you.
Maya Wise.
Hi.
Hi. Welcome to the show.
It's a
So
pleasure.
I made it through the acronym
Did a great job.
reasonably well. Okay, so what brings you guys here? What's so important about the Center for Information and Study of Clinical Research Participation? Okay.
You got right, which we also call CISCRP.
CISCRP, okay.
So we are here today. We're very excited about an upcoming live educational event that we wanted to share with the community. And we're excited to talk more about CISCRP and the educational programs that we offer.
Good. Maya, let me go to you.
Sure.
If I'm in the audience, I'm thinking, what is going on? What are they talking about? So what is it?
So I guess we should backtrack a little bit. Clinical research is the process that every single medication and treatment goes through in order to bring it to market and make sure that it's safe and effective for the general public. So this is something that everyone is touched by, whether you take, a pain reliever or daily allergy medicine or heartburn medication, anything like that went through a process in order to become available to you and to make sure that it was something that's going to work and be safe and effective again.
Okay, so my question, and I spoke a little bit off camera with you, that my first thought on this was, well, the drug companies are making a ton of money. Why don't they just fund it? So where are we askew? What is the need for your center?
So we strongly believe that there's a disconnect in education and lack of awareness about clinical research and what it means to participate. Who are the key players, the risks, the benefits. There's also a lot of distrust about the clinical research enterprise and the pharmaceutical companies. Our role is to really bridge this gap in communication and make sure to show that there are resources that are available if people are interested in learning more about clinical research and actively taking a role in their own health and their family and friends' health. We do receive a variety of different means of funding from companies in the industry, from government agencies and grants, from academic institutions, and also from individuals who believe in the mission and our cause. And one of our big events that we're very excited to talk to you about is Aware for All. It's a live educational event. It's a clinical research education day, is what we like to call it. And we do receive some funding for this upcoming event. We've received funding from EMD Serono, and we also receive funding from local academic institutions in Boston.
Right. So what I'm thinking is that if I had a disease that showed up and my medication wasn't working very well, right, I'd be very interested in finding, does anyone out there have something that I could try? So what is your role in that inquiry that I might make, say, online?
So we have a variety of services. One of them is a free service. They're all free and open to the public. Okay. We have something called searchclinicaltrials.org.
Okay.
And if you say, for example, you're interested in learning if there are any trials that are taking place locally that you could participate in,
right, you
could call into our office or you could fill out a form online. We would just assist with that process if you called in. And we would be able to look into our database. We cross-reference from clinical trials or clinicaltrials.gov and also from the CenterWatch database. And these are all just listings of trials that are possibly available that you might be eligible for. So we'd provide you with contact information of the study coordinator or the research staff and help you, help to really navigate that process. Because for many, it's very overwhelming, especially if they're faced with a life-threatening illness or a chronic condition, and there's limited time to really find out what's available to them. So our role is really to help kind of ease into that process, to provide more information about clinical research, what it means to participate, questions you might want to ask your doctor if you're interested in participating.
So do you have like a protocol for me to be able to know what I should ask?
We have many questions, and in fact at Aware for All, the upcoming event, we provide handbooks to all the attendees. We have many presentations led by local medical professionals and also a chance to hear from patients about their experiences. But we do provide questions that you can ask and just also a listing of your rights as somebody who might be interested in getting involved. For example, that you have the opportunity to understand what your impact was in a trial. And after participating, learning about what was being researched and your role in that, and also that you have the opportunity to opt out of a trial at any time. So we really try to make sure that patients understand we want to provide education and information to them so they can make informed choices and feel empowered throughout this process. They're really as much a part of this process as the health professionals and the researchers involved as well.
Yeah, I know that you're very genuine about this, and I'll share with the audience that we have an in-studio audience, and one of the members just gave blood for a clinical trial. And you said immediately you reached across the room to the person and said, "Thank you so much for doing that." So I know you're very genuine. It was like you very unprompted, so that it's near and dear to you.
Very
How
much.
did this research center start?
So this was founded in 2003. It was actually founded by my father, Ken Getz, and he really he understood that in this industry there was really, and as we were talking before, there's a real gap between communication. There's also a lot of misinformation about there, a lot of myths about clinical research as a whole. And in order to help people feel more empowered, and he also knew that there were resources that were available and accessible, but people didn't really know about them. So he founded this organization to really help patients and families, and patients including healthy volunteers, including people with chronic illnesses or life-threatening illnesses, or people who just want to learn more about clinical research and want to even help their family or friends who are looking for a trial to get involved with.
And your dad had a personal reason you had mentioned that attuned him to this mission, and what was that?
Yeah, so he's been involved with this industry for a long time, but my grandfather actually, this was actually a little bit later, but it's been very personal to my family. We have members of our family who have participated. My father has also participated in clinical research, and just we all felt a very personal connection in my family, and especially through his colleagues in the industry, folks that really felt like patients need more of this kind of advocacy behind them to show we are here for you. We want to empower individuals to feel informed about the decisions that they're making. It can be a very overwhelming process, especially if you're faced and you just find out, say you're diagnosed with something, and to really quickly say, okay, what's available to me? What do I need to learn? What are the questions I should ask to see if research is even a viable option for me for treatment or therapy? So the role of CISCRP, and we really believe very strongly in our mission to make sure that we can educate and empower patients, health professionals, including clinical research staff, primary care physicians, also the media, policymakers, and make sure that there's better communication.
So let's use that segue to come over to Maya. So Maya, how did you come on board to CISCRP?
So it was an interesting, turn of events that ended me up here, and I knew Ellyn previously. I didn't know about her involvement in the organization, but my background is in healthcare communications. So I came at this with a broader understanding of the need for communication and better connections to build between all of these different sectors within healthcare. There's across the board a need for more patient advocacy, a wider understanding of many different health issues and ways that patients and the general public can get more involved in their healthcare. And you need education, you need knowledge in order to get to that point. So I found out about CISCRP through Ellyn and was really excited about the opportunity here. And I think it's incredible that we're a small organization, but there is just so much work to be done in this area. So we're really taking it full force.
And I noticed that your website is incredible, and you're in charge of the website?
Yes,
So
thank
maybe
you.
Roy and, I want to say a thank you to our volunteers, Leo McGowan's manning the cameras. We have Roy Cohen out back doing the producing, and Gina Coe actually showing Roy what to do. So if we can have Gina and Roy, if they can put up the contact information, that would be great for CISCRP. I'd like people to be able to just take a quick look at the website. So the website is www.CISCRP.org. You can also email at awareforall@CISCRP.org. So the whole goal is to make everyone aware that research is being done, that you can be part of it, it can have a great impact. and a wonderful effect. So coming back, you had some thoughts about, one of the things I'm noticing, patient centricity. It's like a byword, a patchword for everybody right now. What is that doing?
So this is bringing about a big shift in our industry right now with more focus on patient engagement and educational programs and outreach to really make sure, as we were mentioning before, that patients feel very engaged in the process of clinical research.
Yep.
So this is giving us a great opportunity right now to also provide we have a wide variety of programs and outreach that we do, but it's a chance for more of these programs to be picked up in the industry and, for example, industry including health organizations that want to team up and collaborate.
Hospitals.
Exactly,
Yep.
and to be able to offer these kinds of programs and outreach to their communities. So it's definitely a buzzword, as you're saying, and we're so excited about it because this is for the past 11 years we've been really trying to push for patient engagement, and we're also seeing a lot of changes in legislation now too. For example, making sure, especially right now in Europe, it's a big deal, making sure that patients are receiving summaries after they participate in research that actually very in lay language, so it's totally converted the scientific and technical language, but into terminology easy to understand about the impact that patients have made in their trial. It's confidential, it's provided to the sites to offer to their patients. It's also a service that we provide. And that's really exciting because it's another way to just say thank you. Like I was saying
Yes.
To the volunteer before, we have so much appreciation for people who participate and give their gift of participation. And that's a big reason why it's very near and dear to me. And I really want to make sure that those people feel like medical heroes. And that's what we call them. Medical heroes are study volunteers, anybody who participates in a trial.
So Maya, what is the opportunity in this idea of patient centricity? How do you get the message out that your organization is a place that can engage, embrace, and bring forward patient centricity?
I think, when you talk about something that's a buzzword, sometimes these words can get thrown around a lot by people in the industry, and it's hard to get to that point where you go from an idea to putting something into practice. And that's where we really try to focus. And we do research on the back end to try to better understand the needs of the patients and the general public. So what is the perspective that people have and the ideas that they have about clinical research? What do they know? What don't they know? And with that information, we can then say, here are ways that the sponsors, so the pharmaceutical companies and the groups that are putting on these clinical trials, can take that information and change the way that they do this, the way that they conduct these trials, and what are additional ways that they can provide resources for patients. And then, so that is the side that we work with the industry, and we try to make differences on that end and improve the patient experience. At the same time, we're educating the general public and the patients so that when they get to that point where they're involved in a trial, hopefully the experience is better for them, but they can also advocate for themselves because they have a better understanding of the process that they're going to be going through, and they're more prepared when it comes to that.
So let's back it up just a second and say, what is clinical research? What is it? I mean, we're talking about it like it's this thing that's we all understand. I don't think everybody knows, including me.
So we'll both answer this question. So clinical research is the process that every new treatment goes through to make sure that it's effective and it's a safe drug.
And the term refers to any trial or any research that uses human subjects.
That's right. It could be behavioral, it could be observational. It doesn't necessarily have to be drug, but a drug-related option. But this is all treatment and therapy options.
So we need people to participate in these trials because it's not only someone who has a certain disease that they're testing a drug for, it's also, when you're thinking back to science class and putting together an experiment that is going to result in, good results, you need a group that's going to reflect the general population. You need to test with healthy participants, as well as people who have, a certain criteria of illness, so that you compare, what is going to happen, is this going to work for certain people but not others? So this is the process that it goes through for testing. There's different phases. So, a phase 1 trial is at the very beginning, when they've realized that this is safe enough to test on people, but it's not quite ready to be put out to market. And so there's usually up to 4 phases where they're testing it in different ways, seeing if a certain treatment is possibly used, for more ways than they even thought it could work. And eventually it gets to a point where they think, okay, it's ready, it's fully safe, it can be approved now. And that's how you end up with all of the treatment options that are currently available.
Right.
And there are a number of key players involved. For example, I'll also add, in addition to the principal investigators and the study coordinators and the volunteers who participate, and the other research staff, there are also IRBs, institutional review boards, who make sure that the standard of conduct and the standard in the system for this research is ethical and that patients understand their rights, what I was alluding to before.
So if I've done a study and I find out later, or how do I find out that, let's say it didn't work? How would I find out, and why would that be important to me to know? If it didn't work, why do I even care?
Well, any information that's gained from participation in clinical research is so important, because that will also help to advance medical knowledge in the future and to continue with finding viable treatment options for everyone.
Even if something doesn't work, we know that it doesn't work. So
that's right.
It's always a good thing.
Huge. It's very valuable.
So you consider one of the parts of your mission is to let people know the results, even if they didn't work, and then they can feel comfortable that they had a piece in producing valuable knowledge.
Absolutely. And talking about that service we were talking about before with communicating trial results, that's a way we're trying to make sure that patients don't feel like they're just dropped after they participate, that there's still continued communication, there's thank you letters that we send out, we provide those lay summaries about the trial and their role in that trial, and in fact other ways that they can get involved if they want to stay a part of this process.
Okay. If you could pick one critical thing that you can't do now that you'd like to be able to do, what would it be?
Ooh, educational or outreach or anything?
I'm just curious, like throw you a curveball, I guess.
Yeah. I would say for right now, just as a preface, we're very proud of the variety of programs we offer. Some we haven't even touched upon. We offer a 5K event to raise awareness and appreciation for medical heroes. That's one of my favorite events to work on. And another is the Aware for All.
Yes.
But let's think something that we would love
Well, listen,
to do,
while they're
there's a
thinking of
lot.
that, Roy and Gina out back, we also have a film to show the audience. And they're going to be able to come up with a really good idea, a good answer for me after the film. So if we can run that would be terrific.
As we will hear in many of the from the vendors and many of the other speakers today, but we want to know, how is it actually impacting your life? What does it mean to an individual?
These are the questions that many people have, and this Houston audience has come today for some answers. Welcome to Aware for All, an educational community event organized by the nonprofit CISCRP to raise awareness about the important role of participants in clinical research and to help people make informed decisions about participating. Local residents engaged with researchers and heard from patients about their experience with clinical research.
And so I would say that my experience with research and participating in clinical trials has been great. Not only had it provided me hope and a second chance, it also helped me found my life mission in research advocacy and cancer prevention in the community.
She's on a regimen now of chemo once a month with a mixture called Doxil, which has been a terrific drug, and that the side effects are virtually nil. We go to do it on a Wednesday, and Wednesday night we're at Papacitos.
Physicians and other research professionals from local health facilities like MD Anderson Cancer Center and the Houston Methodist Cancer Center discussed the types of studies they are working on and the specific challenges to consider before getting involved with research in their disease areas.
Some of my studies investigate the effects of exercise or weight management on cancer survivors and their quality of life.
So what is exciting about what I do is that you have new drugs.
The presentations prompted several questions from the audience.
And I'm specifically interested in the progress that is being made in the area of prostate cancer.
Do you know of any initiatives, programs that really are targeted toward reducing the disparity rates, especially in colorectal cancer?
Aware for All also included a health fair that offered different types of health screenings and information from a variety of health organizations. Betty Stewart helped organize the event here in Windsor Village Kingdom Builders Center. She has personal experience with clinical research.
I was in a breast cancer clinical trial, and the purpose of it was to make sure that we were getting the types of meds and treatments needed for that type of cancer.
Betty also realized she is one of few African Americans that sign up for clinical trials. So when CISCRP inquired about holding Aware for All in Houston, Betty was quick to accept the invitation to help organize it at this predominantly African American church.
It is very important because a lot of times what we get is what other people have gone through clinical trials for, and it may work for that group of people, for that culture, but not ours.
Betty and others who participated in clinical research were recognized and given a unique gift, a book called The Gift of Participation, written by CISCRP's founder, Ken Getz. It provides a closer look at the clinical research process and the important role of the patient volunteers. And to show appreciation for providing feedback in the event evaluations, the CISCRP staff held drawings for prizes.
They had the answers for the diseases and the things that they were talking about, the cancer, the mental depression. It seemed like they had all the answers and the information, the pamphlets. They gave nice gifts and prizes.
Oh, it was very informative, and I learned a lot for doing research, helping out with research study, and I learned a lot as far as what's going on.
And for me, even as a nurse, I learned a lot of information, yes, about how to find out about clinical trials, the benefits, and that the one thing for me was that if I entered into a clinical trial, if I didn't want to participate, I could get out of it. Yes, yes. So it was wonderful information that I will be able to take back to my church and talk to them about participating.
CISCRP, based in Boston, worked closely with MD Anderson Cancer Center's Cassandra Harris to cultivate a strong planning team and organize the program.
This was awesome for our office. Our whole team from the Department of Disparities Research was here. And we also implement a study here at Windsor Village called Project Church, creating a higher understanding of research and community health. And so we have many of our research participants here today, and that shows their continued support for research and encouragement. And so we're encouraged by this, and we want to keep pushing and keep sharing information about the importance of participation, specifically for minorities in clinical research.
So now folks need to really take the initiative to look for clinical trials in their area and how can they really get involved. Searchclinicaltrials.org is CISCRP's website. We can go to clinicaltrials.gov. I love researchmatch.org because it's a passive way that you can put in your information and your diseases or conditions and get stuff sent to you so you don't have to do so much. But really to just get involved, talk to their physician, talk to people in their community about how to get involved, follow up with some of the resources they grabbed today and call and talk to those people. What can I do? How can I get involved?
If your organization wants to host an Aware for All event in your community, or if you just want to learn more, please visit www.awareforall.org.
All right, so we're back with our guests, Ellyn Getz and Maya Wise, and we left them with a question, the burning question: if there was one thing that you could do, what would it be? So, which of you would like to answer?
I guess when we think towards the future, one thing that is really important to us is expanding all of the work that we're doing. We have a global focus as an organization, but of course, with the Aware for All events, we've gone to many cities around the country. We're working with industry professionals around the country, and so we're trying to reach as much of the general population as we can, but we are at this point really hoping to spread our wings globally and look to, spreading the education and getting a better sense of how we can make an impact on a larger scale.
So sort of across languages and across culture. And
Exactly.
so that's going to be a big challenge,
Definitely
right?
a
Yes,
challenge.
we have a lot of materials that have been translated, and also with our Communicating Trial Results service, we translate those blurbs and those summaries into different language. We have, as Maya was mentioning, we've started working with international companies, but especially we're looking forward to 2015, our Aware for All. We're looking at some cities right now where we could really make a big impact.
Well, I'm going to have you elaborate on Aware for All in a minute. But before we do, so let's assume that I'm Portuguese from Stoughton. Or do you have the capacity on your site to say, look, can you download for me or make it available for me the trials and the research that I need in the Portuguese language?
That's something that we're definitely looking towards. And I think that's also a goal that is kind of, we have to look at not only the language barrier, but also those cultural differences as well. So it's not only the words.
Right.
Sometimes it's a few steps beyond that. So it's something that we're definitely working towards right now.
Definitely.
If I didn't speak English, can I call through a translator to you, and will you find a way to help me?
Absolutely.
Okay, so that's, that's what the audience sees, whether you're Brazilian, Chinese, it doesn't matter. The point is, this is an organization of resources that will find a way to help with clinical research questions and get you involved in a way that will be good. So,
and our role is, I'm sorry to interrupt, but we want this to be a personal organization. So it's not that we make sure that we have people who are answering the phones. It's not just an automated service.
Right.
If you're interested in a trial, we want to help and guide and hold your hand throughout the process.
that sounds great. Let's bring it to today's current events. What about Ebola? I mean, how would your organization work to do anything with Ebola?
So and right now, as Maya was mentioning before, we are looking to expand globally into a lot of our services and programs. But if there was an Ebola trial locally in the United States and folks were interested in getting involved with that trial, they could call in and we could help them connect with the research staff associated with that specific
So say
trial.
at Johns Hopkins University,
Exactly.
they're doing something there, so
Right.
you would connect them up.
We could connect them, and then we would help to make sure that that communication is created, and if they're interested in enrolling in a trial, we would help. We'd provide them with any of the resources that they needed.
Wow. Well, that sounds great. Maya, let me ask you to share or sort of elaborate on Aware for All. I mean, is it like a circus? What do you mean? I mean, what is it? What is Aware for All? It's a place you're going to go set it up somewhere. In which town? Give me 2 towns you've done it in, 2 cities in New England or whatever. And then how do you move it? What is it? Things like that.
Sure. So we've been to Boston in the past. It was actually the first place where we ever had an Aware for All event was in Boston 10 years ago. So we're coming back for our 10-year anniversary, which is a really nice kind of full circle event. And in the past, just in May we were in Houston, in January we were in Seattle, so it really is around the country. And these are programs that we do to really bring together an entire community around the clinical research enterprise. I mean, the idea is to get people from the professional side of things to talk to the general public, get that dialogue going, build an understanding between all of these different groups. So we work with hospitals, we work with local health organizations, research sites in the area, and some bigger pharmaceutical companies as well who are sponsoring these events.
Okay.
And
Let me ask you a question.
Sure.
Let's break it down to earth, all right? Walk me in. You've rented an auditorium, the Shriners Auditorium, something. Walk me in the door. What do I see?
You would see the educational exhibits. So in partnering with all these different health organizations, we're able to offer a huge variety of information and resources to the people who come. So you would walk in, you get some initial information about our organization, and then you can walk around and see, maybe the Crohn's and Colitis Foundation has a table, American Cancer Society has a table. We try to get even more of a variety with some holistic side of healing, maybe a nutrition group. And so you can get information, and maybe you have someone in your life who has diabetes or somebody you know who has another chronic illness, and you want to grab some information for them, talk to the people who work for these different organizations. And then we also have health screenings, so you can get free screenings for anything from, you know, a flu shot to the blood glucose testing for diabetes.
So what does this cost me? I walk in the door and they hit me for $50.
Completely free.
Okay,
Yeah.
so you're walking me through the door, it's $50. Who's on my left? Who's on my right? Who's attending?
Do you want to answer that?
Sure. I just want to actually go back for 1 second and just complete just the program itself.
Sure.
As Maya was mentioning, that's what you'll see for the first hour, and often that information or exhibit alley will remain open for the entire duration of the program. It's about 3 hours, and it's on a weeknight to make it as convenient as possible. We do serve dinner. Everything is for free, and it's just a chance to welcome families, welcome members of the general public, patients, medical staff, professionals, anybody who's interested in just learning more. And starting at around 6 o'clock, then we open up to our opening presentation about, and it's also titled, What Clinical Research Means to You. So that's a nice general overview about the process, the key players, risks, benefits, the informed consent. Some of these are buzzwords that folks in the audience might understand, but it's really just a chance to lay out the process and say, this is what it is. This is what clinical research is. Here are some questions that you can ask, and please feel free to connect with the folks that are here. Then we turn over to some researchers and physicians that are very involved in the community with some breakthroughs in perhaps medical research, or just studying chronic illness and have some information to pass along, a chance for them to answer questions. And then one of my favorite parts of the presentation is when we turn it over to patients and study volunteers who have been involved in clinical research. And they can talk about their stories and some of the maybe benefits to them, some of the risks, some things they were nervous about, and some things that they learned from the process, people who helped to guide them through that process. And afterwards, we finish with a ceremony to recognize everyone in the community who has participated in clinical research. And we'll provide a certificate to them and a book that was written by our founder, Ken Getz, and it's called The Gift of Participation. So it's just a nice chance to recognize the individuals who are working on research, who been involved in trials, who are working to research different therapies and treatment options. A real chance to put a face to the clinical research that's happening locally.
Wow. I think if I were to actually get involved, I'd be scared. Like halfway through, I'm getting out of here, and I'd be afraid I couldn't stay.
For the event?
Yeah, no, not the event, but if I actually was doing a clinical research as a participant, I'd get halfway through and go, I want to leave, now I can't leave.
Well, that's actually, you mean leave the trial?
Yeah, can you just leave a trial, or you just...
So
would you be upsetting everybody? Like, do you know what I mean?
So you have a right as a participant to opt out of a trial at any time. That is your right. What we suggest...
So that helps you to get some people in the door, I would think.
Well, what's important is, though, that those folks will communicate with the study coordinator so that they can learn from that experience. Perhaps it was a personal issue with a research staff member, or it could be maybe the person involved is experiencing certain symptoms and they're confused or they're uncomfortable. But what's most important is that there's communication so that that study coordinator, for example, can say to them, for example, maybe it's unsafe to leave right away and there needs to be more of a process maybe to wean off of this therapy. So it's just, that's very widely encouraged to make sure that there's information that the study team can move forward with, and that folks who are involved with the trials do feel comfortable, though, communicating and opting out of a trial if they're uncomfortable.
So do you have, like, I've heard of like a patient's rights platform. Do you have a participant's rights platform?
Absolutely.
You do? So we can download that?
Yes, we can. And that's actually...
Bill of Rights.
Yes, and that's in the...
Participant's Bill of Rights, is that what you said?
Right, and it's in the handbook that each attendee of the Aware for All programs will receive. It's also downloadable on our website. But the goal of the process, and just going back to your question from before, is to make sure that people involved in research feel that this is safe and that they feel that they're being listened to, and that they, again, as we were saying before, they're just as much a partner in this process, and that there needs to be some strong communication.
Wow. So it sounds like exciting. What did you do for outreach? Like, how many people do you expect to show up in Boston, and how did you get X number there? What have you done, Maya, as the communications person? Who are you reaching out to fill the seats?
Many, many, many different groups. So
Okay.
the idea is that, you know, not only are we trying to get as many people to attend on the day of, but we're also trying to really build a grassroots movement leading up to this event. So we want people to be aware of what's happening, why we're doing it, and start that dialogue so that all these groups that wouldn't normally be working together are. And that's a really exciting thing to see. You know, we might have different health institutions in the Boston area that are competing in certain ways, but they're able to come together for this, you know, one cause, which is really exciting to see.
Yeah, so do you go out to various clinics like the Mayo Clinic and say, would you guys like to come in and have a table?
Exactly.
Yeah.
So we do a lot of calls and emails and tons of outreach that way, and trying to get some, you know, major, bigger hospitals and organizations, you know, some national organizations like the American Cancer Society. In the past, we've worked with Leukemia and Lymphoma Society, you know, a lot of these larger organizations, but also some smaller local groups as well, because we want to make sure that on all levels there are, you know, the most outreach that we're doing and getting a real major sampling of the community. So that also might mean, you know, a small local group that is just working as, you know, advocacy within their town. And we want those people to feel just as much involved as some of the bigger groups as well.
What about there are various stakeholders in all of these things, and different groups have been exposed differently. So what I'm thinking about is some minority groups might be more susceptible to a certain disease or a certain thing. How do you handle like trying to get involvement from any given group? And maybe minority was not the correct phraseology or framing, but like a group that, how do you reach out to a group that you'd like to see them come in and then get participation?
We definitely want as diverse a group as possible. And, you know, we're trying to spread awareness and education to the general public. But I think there are certain challenges, you know, when it comes to reaching those minority groups as well, because like we've talked about in the past, the difference in participation is very clear, that, you know, there's lower participation from certain groups. And Ellyn can speak on this a little bit more in detail, that this is going to ultimately have an impact on the research that comes out.
Yeah, I mean, research has shown, very recent research has shown that about 20% of minority groups combined, for example, participated in research. This was in 2007 actually, participated in research, whereas these groups combined actually are over a third of the United States population. In fact, there might even be more now, because that was 7 years ago. But it's so important that there's a diverse group of people, especially, that's a big concern. I mean, that's staggering, 20%. And if that's not reflective of the overall population, then it's possible that the drug sample or the interventional trial or the observational trial or behavioral trial, that won't be reflective of the entire population, and whether or not that's going to work the same way, for example, among different races and different ethnicities, men and women, children and adults. It really needs to be reflective of the general population.
Even age and gender, I mean, I imagine that there are challenges there to get.
Definitely.
Yeah.
And
so I probably don't want to do any of the study group, the control group for a pregnancy test, I don't think.
Maybe not.
Our goal, though, is to also reach out. When you were mentioning for Aware for All, how do we engage those groups too in this conversation? So when we were in Houston, we actually had an oncology-focused Aware for All event, and we reached out to many health ministries, also many churches in that area who have patient engagement divisions where they're really trying to, and engagement programs, they're trying to bring a lot of these minority groups into these types of health education events. We were able to work with them, and we received in that video that we just watched that the majority of folks who attended that event were from the African American communities. And that was really exciting because this is a chance to really better inform that community. We also had a number of folks from the Hispanic and Latin American communities, and we also offered the presentation, What Clinical Research Means to You, in Spanish to also engage and make sure that that language barrier was not existent for the event. So for Aware Boston, we're hoping to bring a very diverse group of people because Boston is very diverse.
Yep.
So we're reaching out to many local health organizations, health groups. I think that we have the African American, there's a community health organization that will be tabling. And we're reaching out to as many folks as possible to work together on this event.
Community groups as well, so YMCAs, local religious groups, churches, synagogues, all of those types of groups where you have people who are all engaged together, and they're going to be more willing to say, we want to take more of an active role as a community.
Yeah, for better health. So if you can go to any kind of civic group or church group or synagogue, as you say, then if you want your congregation to be healthier, come on down and visit us, and you might be able to provide resources.
That's right.
So where exactly is this being held, and how many people can you hold in that auditorium, Maya?
Many, many people.
Okay.
We are ready for anybody who wants to attend. It's at Northeastern University and the Curry Student Center Ballroom.
At the Curry Student Center Ballroom, so once you find that within Northeastern University. When is it?
It's on Monday evening, October 27th from 5 to 8 p.m. And we are encouraging people to register ahead of time. Of course it's free, but once you register, we'll have your information, and the first 50 people to register will receive a free gift card.
Wow, so you're really going to encourage them.
Our main reason for registration also in advance is to make sure we can offer enough dinners and food for the folks and enough health screenings and make sure we have enough resources and space, chairs set up. Yeah. So that's really, and we'll send out maps and confirmation materials after registration. On our website, we also have a map of the campus. They'll be able to find the Curry Student Center Ballroom.
Right. So would you hope for 2,000 attendees?
Oh, yes. That would be amazing.
Yes.
In the past, it varies between 250, 600. I know in Boston, I think there was 500 one of the years. I think that was at the Tufts Medical Center. But we are trying to go for as many people as possible because we want to empower and inform as many people as possible and continue the conversation. Yeah,
it sounds like a great thing. I want to switch gears for a minute before we're going to go to the credits, but not this second. I want to ask you guys personally, if you weren't doing this, what would you be doing?
If we weren't doing this?
Yeah.
That's a hard question.
I keep throwing you guys curveballs. Come on now.
It's something, this is something I've wanted to do for a very long time. I believe in this cause. I grew up in a household talking about this a lot, so I knew for me this was the direction I wanted to go in. So I think
So you're not going to be a Major League Soccer player?
Probably not.
Okay.
I love to perform in musicals. I love to
act.
There it is.
There it comes
I love
out.
to
Okay.
sing. So if I could offer Aware for All and sing in a musical with the information, I would love that.
A musical sponsored by Aware for All. This is wonderful.
But yes, I love to perform in theater and dance and music. So that would definitely be an area that I'd love. But I think right now this is the right place for me.
And how about you, Maya?
I've always been interested in working for a nonprofit, and I really feel like the health communication area is something that I want to continue in. And in terms of other issues that I feel really passionate about, it would definitely be women's health related.
Okay. What would you say to my granddaughter who's 12, the career path she should take to emulate what you guys are doing?
Wow. Well, I think Maya might be able to speak a little bit about the health communications program.
Because she's younger than you, is that why?
Well, we're the same age, actually. But there are new programs available now where you can learn more about health communications and more focused ways of talking about what research is and make sure that it's in understandable terminology and understanding more about the key players involved. My background is business. And I think I've definitely been able to apply a lot of what I've learned to my role as manager of fundraising and development. But I think that if I had more of that background too of health communications, that would really be beneficial for me.
So are we concurring? You're letting her do all the talking? You're not going to jump in and say,
Well, I think, I don't know, when it comes to career path, a lot of people our age, you know, communications, marketing is a lot of the way that people go. And for me, having that underlying cause was the most important piece of it. So knowing that your work is not just necessarily going to sell a product, but it has a much larger impact on, you know, the community, and that you feel like you're making things better in one way or another.
Right? Making a difference.
And it doesn't have to
That's
be
right.
in this way, it could be in a lot of different ways. You know, there's so many different areas where you could put those same skills. So
That's so true. You have to believe in what you're doing. So that's what we'll pass along to your granddaughter.
Okay, thank you very much. So now I'd like to have Gina roll the credits. So we're going to have Gary LaPierre. He'll jump right in, and he'll speak.
Hi, it's Gary LaPierre, and the crew wants to thank Maxie's Delicatessen. That's at 117 Sharon Street in Stoughton. They're 781-341-1662. American Cancer Society, yes, they're looking for volunteers. Drive cancer patients to and from their treatments. 1-800-ACS-6662, or just go to www.cancer.org. Ilsa Mark's Food Pantry in St. Anthony's Free Market, 2 Park Avenue in Stoughton. For more information, call Christine Gallagher. That's at 781-341-0611 or 781-341-0549. Meals on Wheels. Just ask for Jessica. You'll find her at 781-344-8882, extension 2. Stoughton Penny Saver. Our business is advertising your business, they tell us. 27 Rose Glen Street, Stoughton, 781-344-4833. Community Forum showtimes in Stoughton. It's Thursday, Friday, Saturday, and Sunday at 6 p.m., Monday at 8 p.m., Tuesday at 5 p.m. It's on Comcast Channel 9 and Verizon Channel 28. All comments and suggestions welcome. Contact us at communityforum1@yahoo.com. Community Forum showtimes in Easton. Mondays at 9 p.m., Tuesday at 8 a.m., Wednesdays 3 p.m., Saturday 10 a.m. And that too, Comcast Channel 9, Verizon Channel 22. Samaritans, they're at 41 West Street on the 4th floor in Boston, 02111. Their phone number is 617-536-2460. 24-hour helplines for Samaritans, and the number is 877-870-HOPE. 877-870-4673. Samaritans, you can find them at 800-252-TEEN. That's 252-8336. Or find them online at SamaritansHope.org.
And I'd like to add to the announcement, support our Library Association, Inc., 84 Park Street in Stoughton. That's solastoughton@gmail.com, 781-341-0856. Stoughton has a fabulous library, great resources itself, so please feel free to call those people as well and join in the Stoughton Library success. We've also got the Stoughton Farmers Market. It's held at the First Parish Universalist Church every Saturday. I think we have 7 more Saturdays. Saturdays 10 to 2. It's a nonprofit, volunteer-run, wonderful place where we create community. We have farm goods. We have music. It's just a great place for you to come meet folks, get connected to the earth, get food that's been drawn right from the land nearby. It's not processed in any way. We also have some vendors that can give you some food there, fresh catch seafood, and live music, as I said. If you happen to be on the SNAP program, you will get double the produce that you buy using your SNAP card. So please come on down, take advantage of this wonderful Stoughton Farmers Market. And I'm back with my guests, Ellyn Getz and Maya Wise. And Maya, I love your name, Maya Wise.
Thank you.
So you must have taken a terrible ribbing in school at various times. But so what did we miss? We have a few more minutes to discuss things, and you're doing valuable work.
Thank you.
What sort of things would you want the audience to know? If I was energized in the mission, I've got, let's say, a relative who just picked up on a trial drug for cancer and they're doing very well, and I've seen the show and I'm like, I want to help that. What would I do?
Well, we would encourage to get in touch with us. You can call our number. I know we'll have a slide with that posted, but it's 617-725-2750. Visit our website. There's a whole listing of our initiatives and outreach programs and educational programming. So please feel free to reach out to us if you're interested in implementing any of our programs into your own health centers. We'd love to be able to collaborate. So really just making sure that people know that we are available and accessible and we want to help.
Good. And I'm going to take advantage of, that beautiful screen. I was going to be able to say the Center for Information. It's so much easier to read this. The Center for Information and Study on Clinical Research Participation. And again, the Clinical Research Education Day, is that the same as Aware for All?
That's
Yes,
right.
it is.
Yes.
Yeah, okay. So that's Monday, October 27th, and that's 5 to 8 p.m., and that's at Northeastern University at the Curry Student Center Ballroom. And they're expecting 2,000 people, and they would like you to be one of them. And they're going to give you a free dinner. You're going to learn all about how to participate and then there's also an opportunity to appreciate the people who have already participated. And I think that's a great deal of what you're doing. Let me throw a question at you that is a bothersome question. So as I look at things, I try to be reasonably analytic. And I would look at this and say, it seems there's a danger that some of the larger drug companies, and I'll name two just because I know their names, not because they're a danger, but Abbott and Pfizer, let's say, that they would find a way to sway what you're doing to their benefit.
I think that's one of the benefits of the fact that we are an independent nonprofit organization, and we are positioned in such a way that we're working with a lot of these different groups. We do have a lot of our programs that are sponsored by some of these companies, but we are taking that very neutral, centralized vision of just helping the public and the patients. And we keep our mission very sacred, and we make sure that, in working with all these different groups, we remain at the heart of it, the cause that we're going for, which is just to make a difference and to impact the patients and public in a way that is always having their interest at heart. And I think that's why it's so important to have a group like this in this large industry, because it's expected that any for-profit company has their own agenda, and that's not necessarily a bad thing. That's just how they operate. But being a nonprofit and really just working towards our mission is the most important piece, that we're here and we're not doing this for any other reason.
No wonder you hired her. I really like that you said, I've never actually heard someone say our mission is sacred. And I think that if you could maintain that as a central theme, that we have a sacred mission that is to help, it sort of helps everyone, but specifically to the people you're drawing in and drawing from, right? In other words, the everyone is whatever the drug is being taken by whoever it's being taken now and in the future, or not taken if it was proven bad, right? Or proven to be ineffective as opposed to bad. You're still, this idea of protecting in a sacred way seems to be a nice way of putting it. Communications page. So some of your teachers are going to be very proud of you now, right, when they see the video.
It came out. I'm amped up from our recent visions meeting where we talked a lot about our mission and where we see the organization going. So I'm excited.
It is exciting.
And what a great segue. Where do you see the organization in 5 years, in 10 years, let's say?
Well, we're continuing to see this global expansion as we're talking about before, and that's very exciting. We're hopeful to see increased health literacy and people taking more of an active role in their personal health and in their family and community health. We're seeing a lot of our new programs take off, like the Communicating Trial Results program, the Medical Heroes Appreciation 5K events that are hosted at major trade shows around the country. Let's think of some other areas.
I don't think that our work will ever be done. I think, the goal is to make sure that more and more people are getting this education and having a better understanding of the industry and, the process of clinical research and how all of these pieces fit together and their own personal role if they want to get involved and how they can get involved. But even if everyone somehow got to a point where they did have this information, there's always more that I think we could be doing. So, whether that's making sure that, the way that these clinical trials are run is consistently growing and, being changed in a way that is going to continue to work with patients as partners, which is a term that we use a lot. There's always going to be more that we can do, and there's so much technology that's coming out. There's so much advancements in medicine, so it seems like it's only becoming, faster and faster paced.
And in 5 years, I think we're also hoping that our traveling museum exhibit, which we're currently designing, will be in full steam and will be moving around the country and possibly even internationally. That would be very exciting. But that exhibit is being designed just based off of the patient perspective. It's not the process of drug development. It's talking from individual perspectives about clinical research in different communities in each city that we'll visit.
So it seems to me like you would almost want, as a doctor, counsels a person who comes upon what might be considered a devastating disease or a trial, a challenge in their lives, that they would, part and parcel of that, say, and by the way, here's a brochure from CISCRP, and I'd like you to call them and think about alternative ways that you might also handle this disease or trial that you're in.
That's right. And we're making sure that we're providing educational materials to youth. I didn't mention this about the museum exhibit, but that will be made for youth to high school age to be able to really start to provide education to this next wave of generations to come, and to make sure that they are aware of what clinical research is. So that's also our goal, to make sure that we're consistently improving the way that we communicate about what clinical research participation is.
Well, that's fabulous. I'd like to conclude the show by thanking our off-camera Leo McGowan, Roy Cohen, Gina Coe out in the background, Mike Hammond, Jeff Pickett, all these people that have helped with the show. And I want to give you guys an opportunity to say thank you to whoever. So who would you like to say thank you? I know you had to say thank you to your dad and your mom, right? You grew up in a household where this whole idea of understanding clinical trials is your second language. So who would you like to say thank you to?
Well, definitely thank you to you guys. Without you, we wouldn't be able to be here and speak on this platform. It's really exciting, and it's been wonderful to work with you. A big thank you to our CISCRP team.
That's what I was going to say.
Without them, I mean, our team works so hard, and we just thank you to you guys. We know how hard you're working in the office today.
Thank you to everyone who's come to an event.
Yes.
And continued to spread the spirit.
And collaborate with us.
Okay. And thank you very much for coming.
And thanks for listening.
All right. Bye-bye.